Everybody, to another episode of You Learn, You Turn. I've got my co-host Hamilton today, and we've got a great just guest, Justin Azbill. Is that how you pronounce it?
Yep, Justin Azbill.
All right. All right, great. We are so glad to have you. And I usually don't read bios, but I am going to read a little bit of yours because it's just fantastic. But to start off with, just to orient our audience to you a little bit better and us to get to know you a little bit better, I'm going to ask you a couple of questions. Do you mind?
No, go
All
go
right.
ahead.
First question is, when you were young, what did you dream of being when you grew up?
Firefighter.
Oh, that's good. If you could live anywhere in the world besides your hometown, where would you live?
Hmm. Maybe in the mountains of Oregon, close to Bend.
Ooh, where do you live, Justin?
I live very close to Cape Cod, Massachusetts.
Oh, nice.
Okay, that's a beautiful area. All right, well, thank you for that. And let's go ahead and I'm going to read a little bit of your bio and see you're appointed director, National EHS at Milwaukee Tool, responsible for directing the design, implementation, and maintenance of the environmental safety and health programs. He provides oversight to ensure compliance with all applicable laws to exceed safety regulations. He has over 27 years of experience in safety and risk management. He leads several peer-to-peer groups focused on safety, professional psychological safety, as he is an industry advocate for mental health and suicide prevention. He leads from the front in the mental health space and is currently sitting member of the Working Minds Construction Suicide Conference, keynote speaker on the importance of preventative measures, self-care, and a founding member of the Safety Social S4S Safety for Safety peer group meeting. And the last thing I'll say is Justin truly believes every injury in construction can be prevented if you plan ahead and live work thinking about the quote, what ifs. So we can just round it out right now and say, what a great guy, but we're not going to do that.
Hmm.
We at U-Turn Health are doing a lot of work with the AGC and just the construction industry as a whole, and have found that they are in dire need of some help with mental health as well as suicide prevention, and you are one of the key figures on that front. So without talking anymore, I would love for you to tell us a little bit about why you do what you do, a little bit about your personal story, and Hamilton, you jump in as well.
Yeah, sure. Go ahead, Justin.
I've always, since I was a young man, even in high school, signed up to do stuff to help people. That's kind of been my thing. That was how I was raised. You do more for others, more than yourself. Kind of lead others into good things, right? So, from the I was in the Marine Corps, and I was a firefighter for a while, and then I got suckered into safety because it was my journey, my chosen journey that God had for me, and I've been in it ever since. I'm leading the charge because I went through a suicide process in 2020. I was a COVID czar of a general contractor, and prior to that, I was used to taking on lots of responsibility, shoulder it, no problem. When I worked for Keywood, I worked 100-hour work weeks. I mean, ran big jobs. It was not something that I thought would impact me in a negative way. However, I had a wife and daughter at the time, and I take being a dad very serious, and it's like the best thing about my life. And I was failing at that. I was failing at that while at the same time working 20-hour work weeks and, just trying to live life like the rest of everybody and then dealing with everybody's problems. And over probably an 8 or 5 month period of time, I working 20-hour days, started drinking alcohol, stopped my normal preventative measure routines. And one day I woke up, because I didn't sleep the entire night. I was just very mad, angry, just, felt like I was not accomplishing anything and didn't have a lot of worth in my life. And I decided I was going to end my life. And I wrote a letter to my wife, my daughter, and my mother the next morning instead of answer emails. And packed a firearm in a bag, ready to go to work, and was going to take my life that day. Very fortunate. My daughter stopped me by asking me to stay home and spend time with her. She was at school, but it was homeschool.
Hmm.
She said, she called me Papa, which anytime my daughter calls me Papa, she might as well just say, "Hey, can I have your wallet, your car keys, and anything I want?" Right? So, said, "Papa, stay home with me. I want you to spend time with me. I miss
Oh
you."
gosh.
Uh, so I stayed home, and it was the best day I can remember for the longest time. And um, later on, I had a peer group meeting with one of my peer group peers, Josh Rizzo. It's called the Safety Social, and I watched one of my friends break down because he had just lost one of his best friends, and the pain that he had on his face. And I was like, "What am I thinking? I can't do this to nobody." And I called Josh right after, and we spoke for hours, and he helped me through my way. And I'm still part of that peer group to this day. 3 years later, we have it once a month. I have my own peer groups with other safety professionals, and I think it's the answer besides other preventative measures, and that's why I'm such an advocate for it, because not a lot of people really understand what the stigma is. And the real stigma, in my opinion, for me was I had built myself up to such a high level of leadership that I couldn't tell anybody I needed help. I couldn't tell anybody that I was suffering, because I thought I would lose all credibility. I thought I would lose
And
that
maybe
opportunity.
lose your job.
That was a big deal. I wrote about my story. It's in this month's Safety Link newsletter. So it's something that I think a lot of people in the construction industry go through. They're afraid to ask for help because of what people may think or whatever. And to be honest, after I asked for help and I started doing all this, and I don't think anybody thought less of me. It was the reverse.
Yeah.
They think of me as a stronger leader now, and they come to me. And I shared my story today with Turner Construction, and uh, it was a big impact to them, which I'm glad. But not only trade professionals are impacted by suicide in the construction industry, so is leadership.
Hey, Justin, I have just a trivial question. How old was your daughter at this time?
She was 8.
Do you think have you talked to her about it since there? Was this just like she didn't know what you were planning on doing, obviously. Was it
She
just
had
like
no
an
idea.
intuition with her?
I haven't taught. She's 11 now, so
Yeah.
I haven't
Yeah.
fully had the conversation with her yet. At some point, I will, but I don't know how. I don't know how to yet. I mean, she's my little hero,
Yeah.
So
Yeah.
But no,
I,
I
I
get it. I was just curious.
one day, I have a 25 and a 22-year-old as well as a 15, but I was in active addiction for the first 8 years of my oldest life. And when I came home from treatment, she did not want to talk about it. She is 25 and she is ready to talk about it because she's finding there are things that are affecting her now in life. And that's
yeah,
what the psychiatrist I took her to said it's like a car accident. You can't see, like, she will have bruises on the inside and she may not want to face that until much later. And so, yeah, I think your daughter will, she may have even sent something that day. I think, that happens. But I was curious too. Did you ever show your wife your letter or did you just burn everything?
I actually no, I did not show anybody my letters, um, because I think that it would cause some very deep wounds.
Yeah,
That
yeah.
so I have a nice solo stove, and one day I did burn my notebook. It was kind of my way of moving forward, and
Yeah.
it felt great.
I bet that was really cathartic.
Yes.
I do still have my bag. I can't remember. I just had it up here. I have my bag that I put my firearm in because I call it my snack bag. I take it everywhere with me when I travel. It's just a reminder, like I remember where I was that day and I won't go back.
You've mentioned peer support several times, and we're really big on that at U-Turn Health, and I want to know if you think that is probably the best solution to help end stigma and suicide, or what do you see as working well for you and for your leadership team to implement programs into this industry or community, so to speak? I don't know.
Great question. So one of the things I've learned over the last 3 years of talking to as many people as I have in webinars and whatnot is that everyone's different, and just like any illness, medicines work differently with different people, right? So for myself, those peer groups are a way to talk about challenges in life that you're going through and vent and talk about it freely. And what it does for me and the participants is, and you could see it sometimes when something's really heavy on someone, it lifts a lot of weight off of them. We're all humans and we all deal with stress differently, but the talking, getting it off your shoulder, just the fact that someone knows beside you, I think is the concept that helps you heal a little bit. I also write in a journal every single morning right here.
Love it.
I write a challenge I'm having and what I'm going to do about it. And then I always write something good about myself. I'm in safety. It's not the most rewarding job. Not like everyone's like, hey, man, everyone home safe every day to you, or they
Yeah,
usually call you when things are really bad.
right.
So I believe in self-advocating. You have to advocate for yourself and remind yourself of the solid things you're doing in life, because it's not like it's going to happen to you every day, unfortunately. Sleep is good. I try to get 7 hours a night. That was probably one of the biggest parts of my issue. Was mental fatigue was brought on by lack of sleep, lack of shutting down, letting the brain rest. The brain is the biggest magician in the world because it'll play all kinds of magical tricks on you if you let it. And I was drinking alcohol sometimes, that wasn't helping, and then
Yeah.
just wasn't working out. I couldn't run. I mean, I have a treadmill right here. I'm known for power walking every day, whether it's outside, inside, 3 or 4 miles a day, and I'm doing a half marathon on October 8th, and I'm raising money for
Woohoo!
a couple suicide prevention groups. And I'm just you got to set. I always tell everybody, you got to set boundaries. You got to take care of yourself, but also what you surround yourself with. I don't watch any news anymore. I don't watch shows about people getting killed and all that stuff. I just surround myself with comedy, fun, or read a lot. That's just kind of
That's
my
awesome.
boundaries.
Well, it's Justin, one of the things that you said that resonated with me is we're all human beings, and that's our model at U-Turn Health is we treat people like human beings first and foremost, because what we've seen is, and I've been in recovery for over 11 years and struggled mightily for many years and never wanted to raise my hand and say, hey, I've got a problem, for all the reasons that you probably didn't want to as well. But what we found is the way that we traditionally treat this stuff is we don't treat people as humans. There's one way to do this, especially when it comes to addiction, is you got to quit today, you got to quit forever, you got to admit you have a problem, and then you're off and running. And that's just really, really scary stuff. And so that's why I think Liz was asking you the question about peer support, because the model that we've created is it doesn't matter what you're dealing with. We're going to give you someone that's just like you, that's dealt with similar stuff, and they're going to treat you as a human being first. So I love that.
Yeah, I think that in our world of social media and all this other stuff, I think that sometimes we forget the most decent process of life, and that's that we are human and we all make mistakes. We all have life problems, and if we treat each other well and talk to each other, we're all about being better. Uh,
Yeah. So I have a particular question for you about suicide, and I don't know how to ask it. And if I say something that's politically incorrect, just yell at me and tell me to shut the hell up, because But I'm always fascinated, especially with these kids that are now actually following through with suicide. I feel like they don't really understand the finality of it all. It's like there's no coming back for that. You know, I always say if I'm standing on a bridge and I jump, I wonder how many people in the air are like, damn it, I shouldn't have done that. It like, can you walk? Does that question even make sense? Can you walk me through that
No,
thought process?
it makes perfect sense. You know, I met Kevin Hines this summer, and we had a one-on-one conversation after his presentation, and he talks very freely about as soon as his hands left the railing of the Golden Gate Bridge, he was like, "I wish I wouldn't have done this." Right? So
Yeah,
Oh man.
I when it was so instantaneous for me. It was not something that I planned long term or anything like that. It was on Wednesday night at 10 o'clock. I got another email that said I'm going to have to go through what I did the last 4 days, which was a lot of pressure already. And it was someone not on my own team not following the rules that we set. So it was like they didn't care about me kind of mentality, right? So I was such in a bad place mentally from being fatigued. I didn't even think about the after effect. And that's what the next day when I saw an individual on my peer call, the pain he was enduring from the loss of
Mhm.
his friend, it totally changed my whole mindset. It kind of woke me up, right? And so
Yeah.
I can't speak for everybody, but for me, it was so instantaneous, and I was just like broken. If I wouldn't have had someone show their love for me and then as well as see the pain what they would be dealing with after, I don't know what would happen, so
yeah,
I don't know that people think about the after. I think they think about the now.
yeah. It's, it's
What
just
would you
it's a way to get you out. I mean, I always say, you know, we are predetermined to get out of pain, no matter how we have to get out of pain. And if we don't have healthy coping skills, some people take a very negative path to get out of pain, and obviously that's probably the holy grail of negative pain is doing that. But there's other things that people do. Yeah, that's very interesting. Go ahead, Liz. I think you were going to ask a question.
No, I was just going to say, I always, with these podcasts, want to give somebody some hope that might be listening, especially in the construction industry. And, you're in your 20s, you're on the job. In fact, I know someone in their 20s who just joined a big construction firm here, and he's starting on the ground floor, and he's out on site all day, and he's really tired and working hard. And, you know, what would you say to someone like that if they did start struggling with depression, anxiety? They are working too long hours. They can't find a balance. You don't want to get fired, but where is that support if they don't have U-turn Health and they don't have you right there in their backyard? What would you recommend to that person? How do they start the process of talking about it or getting some help?
So and that's one of the things I've been advocating for and talking to people. It's before it gets to that point, setting up preventative measures that are part of your daily routine, knowing that this could happen, right? It's inevitable in the construction industry or any industry, and from any role in the company, especially the higher you get. You
Yeah.
become alone on an island by yourself, right? So, um, silent suffering is like a term that when I heard that, I was like, I know what that means, right? So, um, you don't have to suffer in silence. So if you have two people that you connect with well and that you grow to trust, you go through an apprenticeship or something like that, right? I think it's important to know, set up preventative measures by having a peer group with them. Like once a week after work or before work or whatever, meet for coffee, or hey, let's all go have a late lunch or whatever it may be, and talk about real problems, real things. So in my peer group, every single month we talk about what's a current challenge that you are having, because there's 9 other people in this peer group, that more than likely have gone through it that can give you some advice. But if anything, know that you're there. They are there for you. So you're dealing with things not alone, right? So you hear that you are not alone a lot. So if you set up a peer group, and then so we have text messaging, we have instant messenger, we have all these communication processes available to us. So if one
So
of
is
my,
that streamlined across the country, the texting service that you can, does everyone have access to that?
now I don't have one, I'm saying everybody has texting available to them. So
Yeah.
if my two peer group members, one's on the West Coast and one's on the
Yeah.
East Coast, ever text me in the middle of the night, I'm going to call them. I'm going to
Okay.
be there immediately for them. So if I, because that's part of, part of we're there for each other. I called Josh Rizzo the other day at 9:30 at night on my way home from the airport, and he picked up. What's up, man? You never called this late, and I was like, I was just test running to see if you would answer. He started laughing, but we talked on my way home, right? So that's something that's really keen, and it doesn't matter gender either. Like I know some people that have both genders in their peer group. You don't have to have three, you know, 10. You can have how many ever works for you, but two works for me. We call it our
Yeah.
trio. So
It's, I feel like the construction industry is almost akin to the military in the fact that you have each other's back very, very strongly. And you don't find that. Like I don't picture bankers sitting in the office going, "Man, I got your back. Call me after work if you need anything." But I feel like you've set up this thing where it's okay to call no matter what, even if you're doing well. And then we always say that in our recovery program is that we don't want to just hear or talk to each
yes,
other when things are really, really bad, but establish that relationship before. I was watching a documentary and I highly recommend it, y'all. It's Live to 100, Life in the Blue Zones or something like that. It's new on Netflix and it's about this guy, National Geographic, traveled to, I think they're 5 or 6 blue zones, meaning they live to be 100 or older. And one of the common themes was community. These women that live to be 100, 105 have these 2 or 3 groups of friends and they get together every single day and they
That's awesome.
talk and they laugh. But
that's one of
loneliness
the
in this
keys right there.
country,
Laughter.
yeah, we die 15 years, y'all, before these people do because of loneliness and isolation in this country. And these other places, they're doing it right. And so I feel like community, community, community is the opposite of addiction. It's the opposite of suicide. It's the opposite of everything. I feel like that just sort of encompasses what you're doing. So I want to say thank you so much. Do you have anything else you'd like to share with the audience, Hamilton? Anything? I just
No,
want to
I'm
keep working with you, Justin, in the future. I hope that we can do a lot together to
Sure.
help the construction industry.
Yeah, I
I
do have
just
one question for Justin. And Justin, it's you mentioned that you were drinking a lot when you were going through these struggles, and I think a lot of people do that. One of the challenges I see, and it's Milwaukee Tools is where you work, right?
yep.
Do you guys have a random drug testing program or anything like that?
I haven't been, but I'm also 100% remote employee, so I can't
Okay.
answer for people. We have a lot of
Yeah,
travelers.
yeah, what I'm getting at is a lot of these construction industries, because they're either government regulated, they're state run, have these mandatory testing programs. And I get it. I understand why. I used to run a specialty pharmacy and we had the same thing, and it was important to do that. But the challenge with that is that really hurts the whole harm reduction model because let's say that I'm using opioids and I'm a construction worker and I want to talk to somebody and I want help and I want to figure out how to get off these things. I'm never going to raise my hand and even I'm not even going to talk to a peer group because God forbid if I admit it and it gets reported, I'm going to lose my job. And somebody asked me that question and I've never been able to figure out a solution is how you coincide this harm reduction. We're going to treat you as a human. We're going to get you the help you need, but also keep people safe on the job site. And so as somebody that their expertise is safety, I just wonder what your thoughts are about that.
I'm glad you asked. So musculoskeletal injuries are very common in the industry, and it's part of 35% of all work comp cases in construction are musculoskeletal ergonomic injuries, which usually result in an opiate being prescribed, right? So after 5 days on an opiate, you have a high risk of being addicted to them. So first and foremost, one of the things that you got to understand is if it's prescribed by a doctor, there's not a lot companies can do. They can set parameters for you to try to keep you working that are low risk. But from a professional point of view, one of the programs that a lot of the unions in Boston have started, and it's through the buildings trades, BTEA, and Tommy Gunn started it, was if you are addicted and need help, you can reach out to any one of the people in your at the company, or there are certain people you can ask for help. They will get you help, and the contractors will guarantee your job back once you go through a program.
Phenomenal.
So the old being on the ban list days are over. I think that's a good model to run, because what they've seen is people are more encouraged to get help and more focus on them. And it also says to the trade professionals is, we care about you.
Yeah.
And you're seeing a lot more people good, taking care of themselves, and builds awareness too.
Yeah, that's a great solution, and I'd love to pick your brain a little bit later after that. But thank you so much for sharing your story. I mean, it's obviously, I agree with you. I think that people that have lived through these things, like all three of us, I think it adds credence to. We got a lot of people out there struggling, and there is hope. So go ahead, Liz.
No, I
Thank
was
you
just
for
going to
having
say
me.
thank you, Justin, so much. I'm so glad Bridget introduced us, and I hope that we will do some good work with you in the future. And just thanks for everything you're doing for the construction industry. Talking about it and being open about your story is going to save lives. So
I
thank you so
appreciate
much.
Yeah, I appreciate you guys having me. Thanks a bunch.